Good afternoon, everyone. I hope you can hear me. Let's start. So, first, I want to make some announcements before we begin. Today's session, we are going to discuss a case scenario. I don't really need anyone to present the case today. I'm just going to be talking about it. Okay. Yes, great. Okay, so let's begin. Let's start today's session. So today's session, okay, it's about how to manage a case, okay, a case presentation or a scenario you may encounter in the exam. Okay, so the scenario is as such. Okay, you are an FY2 in the geriatric care center. Mr. Adam Hills is a 57-year-old who was admitted to the center after having a fall. His blood reports are awaited and his blood pressure lying down is 134/82 and standing is 117/80. Please talk to this patient and find out the cause of his fall. Okay, so this is the question you read on the door. Okay, now let's look at the components of this question. It gives you 4 kinds of information. Number 1, it tells you that you are a foundation year level doctor in the geriatric care center. Here you are not located in the GP clinic or in the ER, you are located in the geriatric care center, okay, which means elderly care center. So you are located over there. Second component of information in this question is the patient's name and his age. Okay, now the third thing that they talk about is about the patient. So he had a fall in the morning and his blood reports are still awaited, and they have just given you the findings of his blood pressure. On lying down it is 134/82 and on standing it is 117/80. Okay, so this is the third component of information about the patient that you have. And your task, the last component of your task is please talk to this patient and find out the cause of his fall. So if you see, what is your task is to talk and to find out the cause of this fall. Okay, now in the exam you can have various tasks. They can ask you to take a history and find out the cause of his fall. They can ask you to take a focused history and find out the cause of his fall. They can ask you to take a focused history, find out the cause of his fall and explain in about his management to him. Okay, so it can come in these ways. It's not necessary it should be exactly like this. Please do expect some changes which will be in the question. That doesn't make the question a new scenario. It's just that there is some extra bit of information which is there and you need to decide accordingly what is to be done. Okay, now we are going to discuss how this scenario can come in 2 forms. That is, first one, the one which my question says, please talk to this patient and find out the cause of this fall. That's the first one which we are going to discuss. The second scenario which we will discuss is, please talk to this patient, find out the cause of his fall and explain further management with him. Okay, so these are 2 ways this question can come. I'm going to discuss management of both these ways. Okay, even though it's just one case that I'm discussing, what I discuss in the management is applicable to similar situations or scenarios you may encounter in the exam. Please remember that. Okay, now first let's talk about what is the difference between please talk to this patient and find out the cause of his fall and please talk to this patient, comma, find out the cause of his fall and explain further management to him. Okay, so when you have a sentence at the end of your question, at the end of your task, which says explain further management with him, it means you have to talk a little bit more about the management and you can expect some more information which the examiner will give you. Now please remember, as you go about taking a case in your exam, if you do not ask the right questions, right, you will not get information from the examiner. Okay, how do you decide what should I ask, what I shouldn't ask? Now this is something which everybody this is a challenge which a lot of candidates face. How do I decide in which scenario I'm going to verbalize examination and in which scenario I'm not going to verbalize examination? Okay, now sometimes it so happens that a candidate verbalizes examination and the examiner keeps quiet, they do not give any answer, and you have no other option but to talk about examination, and then it becomes awkward, and a lot of candidates, they get nervous, they may fumble, and they may lose scores. Okay, so let me give you a tip. What are you supposed to do? What are you going to do when you verbalize examination and the examiner doesn't reply? Immediately, please tell your patient, ideally this is what I would have done. I would have examined you for all these things. Ideally, I would have done this. Or you could say, yeah, this is one thing you can say. Or you can say, I would examine you, but after the consultation. Okay, just to make sure I'm not missing anything. So please add any of these 2 points, and you will save yourself from being nervous. Now, when you are nervous, you lose scores. Okay, they mark you for consultation when you are nervous. So please avoid that. Don't be nervous in the exam. Okay, try to still pass your station. Don't give up. You might have heard this a lot of times, that don't give up, try your best, don't give up, try your best, but you don't know how you do that. Am I right? So this is how you do it. Okay, when you have encountered a tricky situation like that, you have verbalized examination, examiner is not giving you any findings, he's just looking here and there, and he's like, yeah, whatever. Now, moving on. So let's talk about how do we start. Okay, let's briefly talk about it. Even though we spent 3 days discussing history taking and examination, we would still discuss what is relevant here, because we want to find out how to tackle this scenario. Okay, so the first thing that you do, you introduce yourself. So I already spoke about it yesterday, how you introduce yourself. So you introduce yourself and confirm your patient's identity and age. Okay, now some people, they ask, can I confirm your date of birth? Please remember, if you are given the date of birth, okay, if it is a sim man, if it is a mannequin, okay, then confirming the date of birth, you have to pick up the documents which may be placed. Okay, there may be a case file, or there may be a band on the patient's wrist, so you can confirm the date of birth with that. But my advice would be, please don't mention date of birth in the exam, because if you are not really good at math, then you have to sit and calculate if the age given to you in the question and the age that the patient simulator is telling you is the same. So don't put yourself in situations like that. My advice would be, just confirm name and age of the patient. And some patients, they say, yeah, please call me Mr. Hills, or they themselves say, please call me Adam. So at that time, don't waste your time asking, what would you like me to call you as? Confirm the name, confirm the age, and what if they have not said some, like I said, suppose I'm the patient, I will say, yeah, my name is Adam Hills, I'm 57 years old, doctor, you can call me Adam. So when I have said that already, don't waste your time asking, is that your most preferable name you would like me to call? Don't waste your time doing that. Okay, just move on. All right, noted. Okay, so how can I help you today, Adam? Just start off. Okay, sometimes they may not say anything, they may just say, my name is Adam Hills and I'm 57 years old. So at that time you can ask, okay, what would you like me to call you as? So he'll say, anything, doctor, anything is fine with me. So at that time, please say Mr. Hills. Okay, please don't say Adam, please say Mr. Hills, Mr. and the last name, not the first name. Okay, especially if it's an elderly patient, please say Mr. and the last name. Okay, now moving on, asking about the event. Now how can you ask about the event? So if you say, how can I help you today, in this scenario, that's not applicable. Well, Mr. Hills, I'm here to speak to you today because I am of the understanding that you had a fall this morning, and I would like to know what may be the reason you had this fall. Okay, so please be confident when you say that, and please, instead of mentioning where you found it from, what you did, this, that, please eliminate all those things and just say, I'm here to speak to you to find out why did you have this fall, because I am from the understanding that you had a fall this morning. Okay, so he will tell you, yes doctor, that's absolutely right, I had a fall this morning. So then you can ask him, okay, can you tell me a few details about it, like what were you doing at the time of the fall, what happened before the fall? So start in small questions because this is an elderly patient. He will say, yes, doctor, I was just making breakfast, and I was just helping my wife make breakfast, and I don't know, I just had a fall. Okay, what happened when you fell? Just one question. What happened when you fell? Full stop. There's no need to add extra information in the question, like, for example, did you injure yourself? Did you soil yourself? Did you bite your tongue? I always say, know when to use your open questions and know when to use your close end questions. An open question starts with when, what, where, how, and why, and questions which do not start with these things are called close end questions. Please remember that. When you ask a patient what happened during the fall, it means they know what to tell you. They will tell you what happened during the fall. If they don't know what to say, if they are confused regarding what you're asking, so they themselves will clarify. They will say, what do you mean, doctor? I don't understand. So then you repeat once again. I mean, when you had the fall, when you fell, what happened? Is there something that you noticed which happened with you? Okay? Don't give him clues. Please don't give him clues. Did you injure yourself? Did you bite your tongue? Did you soil yourself? No. Don't give him clues. Let him say what happened. And this man, he definitely says. He says what happened. Now, like I said, if you are dealing with a native English speaker, now so he'll tell you, no, doctor, when I fell, I just hurt my leg. I just hurt my leg, and I think I have a little bit of a bruise over there. So you can ask him, okay, so how is it now? Did you receive any treatment for that bruise? So he'll say, oh yes, doctor, your senior, he gave me some painkillers, and I'm absolutely fine now. I'm okay. Okay, alright. So I'm here to ask you a few questions, as I said before. If at any point you feel you are in pain or you feel that you would like me to stop, please let me know and I will stop. Okay. Now this is just a formality which you say. You're not saying it because you really want him to tell you that you should stop. It doesn't work that way. Please don't worry about that. Okay. And please remember about elderly patients. Okay. And they are very kind and they are very nice. So please be very patient and very nice and kind to them. Please don't get annoyed. Please don't make faces in the cubicle. Please don't do anything which might upset them. Please don't do that. Okay. Now, moving on. In fact, geriatric range patients in the exam are the most cooperative ones. Okay. Please be very kind and nice to them. Please respect them. Please do not behave otherwise with them. Okay. This is something I want to say. So as I was saying, that he will tell you what happened. So he basically injured himself when he had a fall. Okay. Now next thing, what happened after the fall? So after the fall, doctor, my wife, she called the ambulance, and I went to the ER. Okay. So did your wife witness anything? Like what, doctor? Did she witness that you were confused, or you lost consciousness, or you had any episodes of vomiting? So he says, no, doctor, no, absolutely not. I didn't have any of those things. So you got information from him regarding what happened before, during, and after the fall. Okay. So you are of the understanding that this fall that he had, you still don't know what is the reason. Okay, because he did not say I had jerky movements. He didn't have any jerky movements. He did not vomit. He wasn't confused. He also didn't lose his consciousness. He recovered by himself. The only thing that happened was he had a small injury. He had a small bruise, and he also had a pain, and that was managed with painkillers, and he's comfortable at the moment. Okay, so that's all that you know about his fall. So you would like to dig in further. Now, how can you dig in further? So what are the differentials you may have in your mind now? So what do you think? Why would a 67-year-old have this kind of a fall? And especially when the blood pressure is already given to you on the door, your thinking is more towards postural hypotension. So you would like to ask some things about that, right? So you would ask him, okay, so Mr. Hills, do you have any medical conditions? So he will give you a list of medical conditions that he has. Okay, he has diabetes, he has arthritis, he has increased blood pressure or hypertension, he has so he has these three conditions. And how do you know which condition may have caused this kind of a scenario for this patient? Okay, so basically when he tells you, doctor, I have diabetes, he himself will say, yeah, and it's controlled by diet, so it means it is controlled by diet. Then he says, yeah, I have arthritis, so he will say, yeah, I have arthritis, but it's managed by painkillers. So he's already trying to tell you, my arthritis is not the cause of my fall. Yes, I have hypertension, that is, I have increased blood pressure, and it is managed with medications, and those medications, and just 2 weeks ago my medication was changed, as in my dose was increased. This is what he says. So basically you think, okay, yeah, maybe the medication is still something which might have caused the fall, so you want to know more, you want to know what sort of medications he's on. But apart from that, now he said he's a diabetic, and he said that it's controlled by diet. So please, over here you can dive into diet, and you can ask him, okay, so could you tell me something about your diet? What do you eat? How do you control your diabetes with your diet? So he'll tell you what are the things he does. So here at this point he says, well, doctor, I was diagnosed with diabetes about 2 years ago, and I'm controlling it by diet, but for the last 1 year I'm on a vegan diet, because for the last 1 year I felt like I'm going to have a fall, and and I was too scared to go outside for a walk, so that's why I just thought I would switch to a vegan diet and I could lose weight. So he already told you 3 things from the personal history. He has told you about his exercise, his diet, and he has also told you that he had this feeling like he was going to have a fall. So please elaborate that. When he says something which is positive, please elaborate that. So please ask him, what do you mean by saying you had this feeling that you're going to have a fall? Can you explain that to me? So he says, yeah, it's just that every time I close my eyes or I'm in a dark place, I just feel like I'm going to fall, and that kind of makes me very anxious, and I don't go on walks, or I don't like climbing stairs because of this reason. So you already know what's going on. Okay, so you get a clue from this, that what's going on. So basically he is giving you symptoms of something related to BPPV and something related to postural hypertension. He gives you both of these, so you need to come to the conclusion with this information that he gives you, that either it's this or it's this. Now, benign positional paroxysmal vertigo, right? What are the causes of BPPV? Okay, right at this point you can ask, okay, so you said that you have the sensation of the fall when you are in a dark room or when you close your eyes. Along with that, have you noticed any hearing problems? So he say, no doctor, I don't have any hearing problems. Move on. Finished. That one question is more than enough. Move on. Okay, now he is having diabetes, right? So you want to know, how is his diabetes? It's in good control. So recently, so you can tell him over here that I would just like to assess if your diabetes is in good control or not. So have you been going to the loo more than often? Have you been drinking water more than often? Have you noticed any weight loss or weight gain? Okay, so diabetics can have either weight loss or they can have weight gain. They can have either of them. It's not necessary that they may have only weight gain or only weight loss. So you can ask him, have you noticed any changes in your weight? So at this point he'll tell you, yeah, I have lost like half a stone of weight. Once again, he has given you information from personal history over here. So he has told you that, yeah, I have lost weight. How much weight have you lost? So he says half a stone in about 6 months. So you have this information with you right now that he has lost weight. The other symptoms of diabetes he doesn't have. So now next category of questions would be, have you noticed any problems with your vision? Have you noticed any abnormal sensation in your hands or your feet? So he says, yes, I have noticed problems with my vision, doctor. And then he'll tell you a long story about his vision, that for the past 2 to 3 weeks he has been feeling that his eyes are very dry. So he went to the optician, he got them checked, and he found out that there are some changes in the back of his eye due to diabetes. So you will stop here and ask him, any other medical conditions apart from diabetes? Then he will tell you, yes doctor, I have high blood pressure, I have rheumatoid arthritis, my arthritis is controlled by painkillers, and I am going to the specialist, I'm reviewing with them, so I'm okay with that. Next thing about my high blood pressure, he will just tell you that my dose was increased 2 weeks ago. So here you can ask him, was there any reason why did your GP tell you why your dose was increased? So then he will tell you, yes, because my blood pressure was not in control with the initial dosage of medication that I was taking, and that's why the GP felt it's appropriate to increase the dose of my medication. Okay, that's it, that's all, you're done. Now when you come to P3, you know you are going to ask about what are the medications that you're taking, and when you ask him what are the medications you are taking, right, apart from the ones you told me for your diabetes and your arthritis, at this point the examiner gives you a paper in which all the medications are written which the patient takes. So you will take it from the examiner, thank the examiner, tell the patient, I have the list of your medications with me, and these are quite a lot of medications. I hope you are managing okay with them, because these seem to be quite a lot. So he'll say, yes doctor, but yeah, there are a lot of medications, it's very difficult to take them, all of them per day, but I have to take them, I do not have any other option. Now when you ask him this question, basically you are demonstrating interpersonal skills. Okay, so it is important to acknowledge that the patient is on a lot of medications. Please do not take the list, look at it, and then just start talking about whatever you think is right. Okay, please don't do that. Now once you have acknowledged the medications list, move on to allergies. Okay, family history, not really relevant over here. Okay, but if you have time you can ask, otherwise you can skip, it's safe to skip. Okay, if you ask me, it's safe to skip, because there are a lot of questions which you already asked, you would be running short of time over here. Okay, now moving on. Whom do you live with? He already told you he lives with his wife. Please don't ask that again. Okay, what do you do for a living? That's one question you can ask. So Mr. Hills, what do you do for a living? So then he says, oh, I'm retired, I do not really work. Okay, I'm living on pension. He will also tell you that information. Move on. You already know about his diet, you know about his exercise. You can just ask him, I would like to ask a few questions regarding your habits. Do you smoke? No doctor, I don't smoke. Do you drink alcohol? Yes, occasionally on the weekends. Finished. Your history is complete. So please know how you will modulate your history based on the scenario. Okay, over here, if the simulator has already given me information about my diet, about my exercise habits, once again sitting and asking those same questions just because you want to follow the format of P3 doesn't make any sense. Okay, now you would ask me, a question here would be that, doctor, doesn't it sound like my history is very disjointed? Right, this is a question which a candidate can ask me. Doctor, doesn't my history sound like it's very disjointed? For that, my reply would be, no, your history doesn't sound like it's very disjointed. In fact, your history sounds like it is being elaborated at the appropriate places where it has to be elaborated. Now if you do not, now let's just imagine, if you take the whole diabetes thing and you ask it in P1, right, that time you will be making it disjointed. So in P1 you're just going to ask about the fall and move on to P2. When I say history is very disjointed, right, what I mean is asking components of P2 in P1, asking components of P3 in P2. For example, you were asking about diabetes, you were asking about the diet. Okay, now because it was relevant, patient said, I'm taking a diet, I'm controlling my diabetes by the diet. So you asked about the diet and he told you about the diet. Then you asked him about abnormal sensations, and you were exploring the part where he said, I feel like I'm going to fall. So he told you about his exercise habits also. Over here, if your next question is, can you tell me something about your habits? Are you smoking or are you drinking? That makes your history disjointed. Please don't do that. Okay, don't ask about habits just because the patient has told you about his diet and exercise. You are still in P2, so your next question will be any other medical conditions apart from diabetes. Did everyone understand what I'm trying to say? If you ask about habits in P2 itself, the rest of the history the simulator will not tell you, because according to him you have finished asking history. He will not reply. Whatever you ask after that, he will not reply, or he will say, no doctor, no. Okay, so please don't do that in the exam. Please remember that you are still in P2, and after you have finished asking about everything about diabetes, your next thing would be to ask about any other medical conditions. Now, yes, exactly. You have to acknowledge at the same time, and you have to move on to the next category of questions in P2. Please don't move to P3. Okay. Now, the other thing I want to say is, I had said in one of my sessions that whenever you have a geriatric patient, please do not miss out 3 questions. That is, how is your vision, how is your hearing, and how are your bowel and bladder habits. Okay, I had said that. So what I see is that this has now become a part of the format. Please don't make these questions a part of the format. You cannot do that. You know why? Suppose now I'm in diabetes. Okay, I've taken a history about the diabetes. I'm in P2. Okay, my location is, I'm located in the P2 category of questions. I've asked about diabetes, I've asked about hypertension, I've asked about increased cholesterol, asthma, and then I'm asking him, how is your vision, how is your hearing, how is your bowel and bladder habits. It sounds very scripted. Please do not do that. These 3 components are important, but it is also important to realize which of the category of questions you are going to put these 3 questions. Okay, so I already told you, this patient said, I feel like I'm going to have a fall whenever I close my eyes, or I'm in darkness. Okay, so at that time you asked him, any problem with your hearings? It becomes relevant. Why? Because you're trying to rule out BPPV, so it has become relevant over there. In the next category of questions, I'm in diabetes, I'm asking about diabetes, so I asked him about his vision, I asked him about his bladder habits, and I asked him about abnormal sensations in the feet or hands. So I have finished, so I have covered them. Please do not make these 3 questions an extra part of your format and ask them without any correlation to the condition that you are elaborating. Moving on. Okay, so we talked about P2, we talked about P3. Now let's go to examination. Okay, so what would you do over here in examination? You will check for this patient's observation. Okay, you'll do a general physical exam, you'll take a look at the bruise also. Okay, and you will review all his systems like cardiovascular, neurological, and abdomen. Okay, so these are some examinations that you would do, right? And as I said, if examiner doesn't give you any findings, please say that ideally I would examine these examine all of this for you, or at the end of the consultation I would like to examine you once again so that I have not missed out anything. So you would say this and move on to the tests. Now in the tests you will say that Mr. Hills, your blood reports, they are still being awaited, but you know, when we examined you, what we found out was that your blood pressure, when you were lying down it was this, and when you were standing it was this. So you will tell him the value and you will say this to him. Why? Because any positive finding that you have either in the question or the examiner gives you, please always repeat that to your patient and explain your patient that. Okay, now you will also tell him after this that I was asked to find out the cause, the possible cause of fall in your case, and what I feel is that the possible reason why you would have had this fall is, one, due to your diabetes. You said that you had dry eyes, right? So so right now we would take a look at your blood sugars levels, if they are in control or not. And you also said that there are some changes in the back of your eye which were mentioned to you by your optician. So we would give you a referral to the eye specialist and see what's going on with that. Perhaps you may need to be started on some medications for your diabetes. So we will look into that and we will keep you updated once your report and your review is with the eye specialist has been done. The other cause of your fall would be the vegan diet, right? It can be one of the reasons of his fall. So what we would do is we would give you a referral to our specialist, a dietitian. They would review with you and also go through your diet chart and give you an appropriate diet suitable for your age and your needs as per your age. Okay, so this is one thing. Then the third thing is, when do we make a diagnosis of postural hypertension? When the systolic is 20 or more, diastolic is 10 or more, right? So when you have either systolic 20 or more, diastolic 10 or more, so that's the time you make a diagnosis of postural hypertension. However, this patient has 17, so it's just 3 points less than 20. Okay, I'm not saying that postural hypertension cannot be a cause. It can be a cause, and his medication, which was recently increased, could be something which may be adding to it. So what you will tell him is that even though your lying down blood pressure and your standing blood pressure, okay, there is the difference between the two of them is 17. Okay, we would like to get this reviewed by the specialist. Okay, that's all. So you're not telling him that you suspect postural hypertension, but it could be a reason. Okay, this patient is on many medications. First thing, he's on many medications. He is 67 years old. He's in the geriatric age group. Then he's on a vegan diet, and there are many factors which can contribute to his postural hypertension. So the increase in dose itself could be something which is, it's not already diagnosing him as postural hypertension, but it could be making this worse. Okay, so maybe the change in posture and then him actually having the fall could be one of the reasons why he had a fall. Okay, I'm not saying that this is the only reason that he had this fall, but you can just tell him the difference, that this difference has come out. Okay, it's 17. It's a little bit concerning, so we want to look further into this matter, and for this reason we would also get you reviewed by a heart specialist. That's all. Please don't say, there's no need to say postural hypertension in the exam, but you can tell him that this difference of 17, it is quite concerning, so we will review your blood pressure medications with the heart specialist. Okay, yes, you can offer to repeat also. Yes, that's a very good idea. You can offer to repeat, and you can say we would want to look into this further. So there are 3 reasons why this patient had a fall, and I told you what are you going to do for these 3 reasons also. Okay, so in the beginning, if you remember, I said that there are 2 ways this question can come. One would be talk and find out the cause of the fall. The other way would be talk, find out the cause of the fall, and discuss further management. So I already told you what are the points you are going to say in further management. So if you do not have time, right, to finish the station, okay, because the history itself is very long. So if you do not have time, just verbalize the causes of the fall at least before you leave the room. So tell him, the reason why I think you may have had the fall is these 3 things. 1, because of your diabetes. 2, because of the vegan diet. And 3, because of the difference in your lying down and your standing blood pressure. So these may be one of these reasons, or it may be all these 3 reasons. We need to investigate it further. Your announcement comes that the time is up, so you just move on. Don't worry about anything else. Please don't sit and continue once the time is up. Okay, you will lose scores for that. Don't do that. Okay, now when the announcement has been made, move on. Now if you have time, you can, and the question says discuss further management with him, at that time you will tell him further management, that is involving the eye specialist, involving the heart specialist in his care, and keeping him updated. And if you have time, please give him red flags also. Now over here, what are the red flags he should watch out for? Number 1, this patient sustained a bruise to his leg, so please ask him to watch out for any sudden swelling, right, or inability to move his leg. Okay, it can be an impending fracture, it can be a hairline fracture, so you're giving him a red flag for a fracture. And the second one would be, if you would like any assistance to use the loo, please let one of us know, we will help you. If you would like to, please try to avoid any sudden changes in your posture. Okay, so if you are lying down and you would like to sit up, do some exercises. Okay, we will teach you some simple exercises. Please do that and then sit up. From sitting to standing up, once again he needs to do those simple exercises and then stand up. Okay, so this you can include in red flags. It is not wrong. Okay, because you are telling this patient that if you suddenly change your posture, you may fall once again. So you are signposting him for the fall, and you are also giving him a solution. You can place this under red flags. It is not wrong, but please, if you have time, do say this. Okay, so this is about this scenario. So this is about this case. Now, what are points in management Okay, there are two sorts of management. One there is a management where you have 4 minutes, there is a management where you have only 2 minutes. When you have 4 minutes for management, please remember to say the following things. Number 1, what is wrong with the patient? Number 2, why do you have any questions about what is wrong with you? Okay, so you are basically incorporating ICE in your management. When you have 4 minutes, please do ask your patient if they have any concerns regarding what you have told them right after you tell them what's wrong with them. Okay, so first thing, what is wrong with them? Then ask them, do you have any concerns about this? Do you have any questions about what is wrong with you? They'll say, yeah, I don't understand why I have this. Then you will explain him from the history, from the examination, why you think this is what is wrong with him. Okay, then ask him, are you okay with this information? So he'll say, yes doctor, I am. Now what are you going to do for me doctor? He will ask. So then you will say, yeah, we are going to do this for you. So treatment, active treatment. If you're going to give him painkillers, please tell him painkillers. If you are going to refer him, please tell him you're going to refer him. Whenever you say referral to a patient, please give the time frame. It could be immediate, within a few hours, it could be urgent, within 2 weeks, or it could be a routine referral which may take up to 4 to 6 weeks. So any of these 3 referrals you need to tell your patient about if you're planning to give a referral. Next thing would be red flags, what you should watch out for. Red flags, right? Safety netting, otherwise known as. So if you notice any bleeding, any dizziness, then what do you want this patient to do? So if it's a very, very serious red flag, decide whether he needs to go to the ER or he needs to come to the GP clinic. So decide which which red flag where this patient goes. So you need to be very clear about these things. Know for which red flag he needs to go to which department or which place. So if it's a red flag which can be managed in the GP clinic, come back to us. If it's a red flag which needs to be managed in the ER, please go to the ER. Okay, so this is about red flags. And last thing is follow-up. So when do I come for a follow-up? It's either after 1 week or it's after 2 weeks. In case of OG scenarios, after 3 months, or after 6 months, or after 1 year. Okay, especially in the ladies, please be very mindful. There are different conditions where they need to review 3 monthly, 6 monthly, or yearly. Okay, so this is about referral, follow-up. Next comes review. So here, if you have a differential that you are talking about, then it's safe to mention that you would like to get it reviewed by your senior. Okay, if you are talking about a probable diagnosis, right, and there is a medication you cannot prescribe, you have knowledge that you cannot prescribe this medication, you can involve your senior. But in each and every case, for example, if you're talking to a parent and it's a reassurance case, right, it's a pediatric case, it's about giving reassurance to parents, reassure the parents, and there is no need to mention senior over here. Okay, there is no need. It will not give you any extra marks. And the other thing which I always say, please do all of your management and involve your senior as the last point in the station. If you tell the patient, okay, this is what is wrong with you, and the next thing that you say is, I would like to get you reviewed by my senior, and your time is up, even if you have picked up what was wrong with the patient, okay, you will still get a 0, because it demonstrates that you are not confident about the management of the diagnosis that you made, and you will not get a pass. So please remember, even if you are at that point where you told the patient what is wrong with them, your next sentence should be, so what we are going to do for you now is, and then your time is up. It's still okay, you can still pass. But if you had involved your senior as the second point or the first point when you started talking about management, do not expect to pass. Okay, as an FY2, right, because you have already received foundation year level 1 training, they expect the doctors to know what they are going to do. They do not want you to call the senior. If your question mentioned you are an FY1 in the GP clinic and you involved your senior as the second point or the first point even, it makes sense. This is why I gave you a very long 1-day lecture saying you have already finished FY1 and you are FY2. It means you have been through different departments and you know about different conditions. Please do not involve your senior as the second point or the third point. Okay, please don't do that. Senior comes in the end. They always come in the end. Even if you have missed out saying senior in any of the cases, do not worry. Okay, it's okay, you can miss out senior. There are some cases where you need to involve the senior in the third point, and those are usually the ethics stations. Why you are involving the senior as the third point is because it is something where you need to involve someone who is experienced in the ethical scenario that you're dealing with. And this is not said by me, this is said by the GMC UK itself, that when you feel that your knowledge in dealing with this scenario is not up to the mark, you can seek advice from an experienced colleague. So they themselves, the GMC UK itself, tells you on their website itself when it is okay to involve the senior. Please read, you will find this statement over there and you will know which are those scenarios you are going to involve the senior as the third point, not even the first or second, the third point in that scenario. Okay, the rest of them which deals with medicine, surgery, pediatrics, psychiatry, senior comes in the end. Okay, in ethics it is allowed. In the rest of them, please try to do your job as much as possible and then move forward. If you have a question that this is it for today. So tomorrow we will discuss examination scenarios, interpersonal skills, and negotiating management in examination scenarios. Okay, so this is what we are going to do tomorrow. All right, so today was this. It was quite an elaborate session. I said too many points. I hope that you were able to follow them, and I hope I wasn't too fast, but if I was, then I'm really sorry. My apologies.